What's up guys, it's Pradeep here with channel Ace PANCE. Today I'm going to address the most common question that I get asked, and that is how to study for PANCE. Now guys, I guarantee you this is not an easy question to answer. The reason for that is because PANCE is a very complex exam and there's no one resource that can really be used to study for PANCE. Okay, another thing is everyone studies differently. So what works for me might not work for you. And for that reason, it gets very hard to answer this question. But today I'm going to attempt to give you guys an infrastructure that really anyone can use and incorporate their own studying habits and methods and use it for themselves to study for PANCE. So today's topic is how to study for PANCE from day one of PA school. And I'm going to do this by getting you guys into the mindset of the test maker by using the NCCPA PANCE blueprint. All right. Now, if you do end up watching the entirety of the video, then I'm certain that this will not only help you with PANCE, really any exam during your PA school, okay? So if you do watch the entire video and you get any value out of it, please support the channel by liking and subscribing to the channel and hitting the bell button for future videos. I would really appreciate it. So without further ado, let's get started. All right, before we move on, let's look at how to find the PANCE blueprint. Just simply type in NCCPA PANCE blueprint and click the first link, and it will take you to this page. If you scroll down, you'll find this link right here. Click on it and it'll take you to the PDF. This blueprint gives a very good gist of as to what's going to be on the PANCE. However, the test makers are not just limited to these pathologies. They give a disclaimer here on their website that they can't possibly list every single pathology that's out there. So for that reason, they have listed the most common ones, and you should start off by getting these down first, okay? So basically anything that's related to medicine is a fair game for PANCE, all right? But in my opinion, if you get everything down that's on the PANCE blueprint, I have no doubt in my mind that you're going to do extremely well on the exam. Now, the PANCE blueprint is divided into two categories, the medical content category and the task categories. The medical content categories is further divided into 14 organ systems, and those organ systems are divided into 450 pathologies. Task categories is divided into 6 subcategories. For each one of these, they have given you percentage breakdown as to how much of each subcategory is going to be on the exam. Now, this information is quite useful, not as much as it used to be back in the days, but still gives you the information about the subjects that you're going to be heavily tested on, okay? Now, one thing I want to point out before we move on, if you do end up going on the NCCPA website and try looking for the PANCE blueprint, you might find the old version of it, okay? On the old version, cardiology, pulmonology, GI, and musculoskeletal made up about 50% of the exam. But now NCCPA has changed that, and they have brought that percentage down to about 40%. So before you download it or print out the blueprint, make sure you're looking at the correct one. It has to be the one from 2019. I'm not sure why the NCCPA have not updated it on their website, but just be careful when you're looking at it. Now going back, you can see both the medical content categories and the task categories add up to 100% each. That might be confusing to some of you guys. The way this works is that the test maker uses the task categories to test your knowledge about the pathologies listed in the medical content. Basically, task categories are used in conjunction with medical content. This applies to all the task categories except professional practice. I really think professional practice should have been a category in and of itself just to avoid confusion. But basically what professional practice includes is knowing about HIPAA rules and regulations, advanced directives like living will, DNR, DNI, code status, and etc. It's about 5% of the exam, which equates to 15 questions. I really don't think you guys need to spend any time on this category because your didactic year and rotation should be more than enough to prepare you for this 5% of the exam. The rest of the 95% of the exam is dedicated to medical content. To make things simple, I want to change the percentage into number of questions. The way I'm going to do this is I'm going to take the total number of questions of PANCE and multiply it with each percentage. Now keep in mind that 15 of these questions are already given to professional practice, therefore the total number of questions that we're left with are 285. So do the math with the 285 number. That's the math I'm using to get these following numbers. The reason behind as to why I'm doing this is to just put things in perspective for you guys. As you can see on the medical content side, cardiovascular, gastroenterology, musculoskeletal, and pulmonology makes about 40% of the exam. And on the task category side, management makes up about 40% of the exam. Okay, and when I say management, I'm referring to patient education, preventative medicine, medical and surgical intervention. Medical intervention refers to your pharmacology. Now the question is, how do we use all this information to help us study for PANCE or really any exam during PA school? And in order to do that, we need to organize the task categories a little better. And I've done that by splitting it into the following 9 subcategories: pathophysiology, epidemiology, etiology, clinical presentation, physical examination, diagnostic approach, management, complications, and prognosis. I'm sure if you're in PA school, you're already familiar with this format. But for each pathology that's listed on the PANCE blueprint, you should be running through each one of these categories and answering them, because this is what the professors and the test makers for the PANCE are going to use to prepare our exams. Now that we know that, we can channel all our energy into studying these 9 subcategories for each pathology. This should start right away in the classroom. As you're learning about the pathologies, make sure you're mentally checking off all these subcategories for each one of them. If for some reason one of the subcategories is not covered, you can ask your professor or use your own resources. I personally used to use Harrison's and a couple other textbooks and online journal articles. Now, this is time consuming, so what you can do is you can split the work amongst yourselves, and that will save time. Also, figure out early how you like to study, whether that's through PowerPoints, index cards, writing notes on WordPerfect, or actually writing it on paper. That's what I used to like to do. I used to do that in a Q&A format. For example, let's take pulmonology. I would make questions like, what is the most common cause of hospital-acquired pneumonia or community-acquired pneumonia, or define what hospital-acquired pneumonia is versus community-acquired. So I would make questions like that, and I would use them to test myself to prepare for the exam. I believe it's more of an active reviewing because it forces your brain to reiterate the information to yourself. Now, this is very helpful when you're taking a multiple choice exam, because your brain is already used to accessing that information without getting any hints from multiple choice. Not only that, testing yourself helps you determine things that you can't memorize. Now, what I used to do was I would write those things down on a separate piece of paper that I would always keep in my wallet. And I would review that paper at least 3 times during the day. Once when I would wake up in the morning, second time before having lunch, and lastly, right before retiring to bed. So I would do this for each organ system, and I would organize them well. So right before the exam, I can easily review, or like right before PANCE, I can just easily go through my notes in an organized manner. But that's very time consuming, and it really hurts your hand after a while. And for that reason, I would really suggest that you move your things online, because it's easier to share with each other, and long term it's just easier to store because it takes less physical space. Another way to use this blueprint is to pinpoint your strengths and weaknesses. As you're going through your clinical medicine exams, make sure you make a note as to which organ system you did well in and which organ system you are weak in. So down the line during rotations, you can work on your weak points and study up. And you can do the same thing with task categories. These statistics are very important, especially when you're deep into rotations or are about to take PANCE. These statistics are really going to come in handy, because at that time you're going to want to know what you need to focus on, and I guarantee you're not going to remember unless you actually organize them from the get-go. Now lastly, I want to give you guys insight into the mind of the exam maker, and I'm going to do this by giving you guys examples of my own questions and how I use task categories to test you guys on the pathology. And by doing so, I hope you guys can see what the exam maker is thinking, and hopefully this can help you mold your study plan accordingly. So I'll be going over each task categories one by one, but I'm going to skip epidemiology for now and go over it at the end. So let's start with etiology first. Majority of the time, the way the test makers use etiology is by asking the most common cause of a pathology. Now, I've done this a few times with my own questions, where I'll either give you a simple question like, what is the most common cause of acute tubular necrosis? Or I might give you a clinical vignette, for example, with this subarachnoid hemorrhage question, where I painted a picture of non-traumatic subarachnoid hemorrhage and asked you what's the most likely cause. For IG, it works for me to do, the first method, but for your PANCE and your exams, most likely your professor is going to use a clinical vignette to ask you what's the most likely cause or the most common cause, okay? Let's move on to pathophysiology. As I'm sure you guys remember that in task categories, the basic science made up about 20% of the whole exam, which equates to about 30 questions. Pathophysiology falls in that category. As you can see in this question that I posted, where I directly ask you pathophysiology of Wolff Parkinson's disease. You might get something similar. You might get something about physiology. So these are the sort of questions you can't expect in pathophysiology. Now, I understand it's not heavily tested on PANCE, but I still believe that's very important for you guys to learn it during your PA school, because it will not only help you understand the pathology to its full extent, but down the line, when you guys forget the mnemonics 4 or 5 years down the line, this is the stuff that's going to come in handy for you to retain material. Because remember, as PAs, we can practice in multiple fields, all right? So you want to retain information and have the options of working in different fields at any time. Okay, that's how you leverage yourself on the market. Don't limit yourself to one specialty. Always have options open just in case you need to switch over to another field for financial reasons or schedule or lifestyle reasons. You need to be in a place where you can do that. And the only way you're going to be able to do that is if you're able to retain information long term. In terms of history taking skills, what the test maker is trying to do here is to test your ability to interview a patient. So basically, just based on the chief complaint, they want you to be able to come up with a list of differential diagnosis without doing any labs or imaging, and solely based on history taking skill. The way they're going to test this is by giving you guys a clinical vignette and possibly a diagnosis of the chief complaint. Then they will ask you which of the following in patient's medical history or surgical history puts the patient at risk for developing this particular pathology. Now let me give you guys an example. Let's say a 52-year-old male comes in with past medical history of hypertension, hyperlipidemia, diabetes, gout, and hypothyroidism, complaining of right flank pain radiating to his groin. The US shows that he has hematuria, and CAT scan shows that there's a 5 mm stone in the right uterus. And the question might ask you, which is a risk factor for developing renal calculi? Again, the purpose here is to get you in the mindset to ask the right questions for each pathology. And as you're going through clinical medicine, when you learn a disease, try to imagine yourself as a clinician and ask yourself, what questions are you going to ask if this patient presents to you? That's the whole purpose here, to be able to ask the right questions and be able to eliminate your long list of differential diagnosis, so then you can focus on doing fewer labs and fewer imaging. I hope that makes sense. Let's move on to physical exam now. The thing with physical exam is something that you can focus on from the get-go are the classic signs and symptoms. From day one, as soon as you hear the classic signs, symptoms, triads, pentads, write them down separately. Okay, because down the line it will make it very easy for you to review them. A good portion of this category does focus on that. There are a few ways to test you on this. They might define what the sign is and ask you to identify it in multiple choice, or they might give you the pathology and ask you which sign is indicative of that pathology. For example, with aortic regurgitation, we see widened pulse pressure, water hammer pulse, the Musset sign or Quincke sign, and there are a couple more there. Or with appendicitis, you might see McBurney's point, Roswing sign, obturator sign, Pessoa's sign, and with acute cholecystitis, you will see Murphy sign. I'm sure by now you guys starting to get my point. I would recommend making a separate list of these on the side for easy access down the line. You can do this with PowerPoints where you can list the name of the sign on one slide and on the next define it, and do the same for all of these. This will make it easier for you to test yourself. Just put it on full screen and go through each slide. It's quite effective. Again, active reviewing over passive. Another advantage is that you guys can split the work amongst yourself and put the PowerPoint together and share it with each other. Now, before we move on to the next category, I do want to emphasize the signs are not the only thing that you will be tested on the physical examination. There are other things like heart sounds, lung sounds, cranial nerves, and etc. that will be on the exam. And the best resource to use to study up for this is the Bates. I'm not sure if the format has changed with the new editions, but in my old edition, as you can see, the tips written on the side of the text with pink font are quite useful, and I will really go through them and try to understand and memorize them, along with the tables at the end of the chapter. These tables are extremely useful. They have a lot of pictures and they're well organized, so it's one less thing for you to do since it's already done for you. So maximize this resource and use it effectively. I've seen many students kind of drop bait when they're studying for their exams. Don't do that. It's not only important for your clinicals, but for your exams as well. It's a very useful resource, so please use it. Alright, now let's move on to my favorite category, the most likely diagnosis. I used to love getting tested on these, and I love making questions on them. Now, as a student, I used to love these questions because one, it made me feel like I was Dr. House, and two, it gave you a lot of leeway. Even if you didn't know everything in the question, there were ways of eliminating choices and increasing your chances of getting the question right by 30 to 50%. Whereas with the other questions, you kind of either know it or you don't. I'm sure if you guys follow me on my IG page, you must have seen me use this category a lot, and it can be used as a clinical vignette, or I might give you an EKG or a CAT scan or chest X-ray or a CT scan of the chest and ask you what the most likely diagnosis is. Now, in terms of diagnostic approach, there are only a few ways that you can make your diagnosis. One is through clinically, and if that doesn't work, then you can follow it up with your lab or imaging. And the two main ways the test makers will test you on this is either by asking what the initial test of choice is or what the gold standard is. So make sure you know that as you're going through your pathologies. Also, there are some pathologies that can be diagnosed clinically, and for some of them, there are certain criteria, like the Jones criteria for rheumatic fever, McDonald's criteria for multiple sclerosis, and Duke's criteria for infective endocarditis. And there are many more like this. Like I mentioned before with the signs and physical examination, make a separate list for these in a separate document or whatever you like, because it's very important to stay organized in PA school. There's so much information we're thrown at, and if you're not organized, then it will get overwhelming as you progress through PA school. Now, next up is management. As we had discussed before, management makes about 40% of the task categories, which is a huge number. So it's very important that we pay close attention to this and prepare for it from day one of PA school, since it's such a large portion of your exam. And management can be broken into a few portions. Patient education and preventative medicine, both of them kind of go hand in hand, followed by pharmacological and surgical intervention. Now, pharmacology, make sure you know mode of action for each one of the drugs, you know their side effects and contraindications, and pregnancy categories. Now, for pregnancy category, you don't have to remember for every single drug. Usually what you can do is take the whole drug class and see what pregnancy category it falls in. Majority of the time, you can get away with that, as long as you have some idea which ones are safe to use and which ones are not safe to use. And sort of the same concept applies here as it did with diagnostic approach, where you need your initial treatment and the gold standard. Also, for antibiotics, know your alternatives. If the organism gets resistance to one antibiotic, what other antibiotics you can use, or if the patient is allergic to medication, for example penicillins and cephalosporins, what other drugs can you use instead? Or if the patient is pregnant, what other drugs can you use as an alternative? And for surgical procedures, know their indications as to when they should be done and what the complications are. Also, one thing that I forgot to mention before, as we had spoken earlier, 95% of the PANCE exam is based on medical content. Out of that 95%, 20% is dedicated to general surgery. So make sure you review your general surgery well. This is where your surgical procedures are going to come from, okay? No one's going to expect you to know the complications of neurosurgical procedures, cardiothoracic, or anything like that. Most of the procedures that you will be tested on are going to be from general surgery. So just keep that in mind. As you can see, I have a few examples up here. So let's get through them really quickly. In the first one, you can see that I'm trying to see if you know the complications of gastrectomy. In this next one, I'm trying to see if you know mode of action of Bactrim. Both these drugs act synergistically to kill bacteria. It has nothing to do with absorption, secretion, or allergies. The reason why they're put together is because both of them work on inhibiting folate in different ways, and in that sense, they're synergistic and killing bacteria. Now, in this next question, I'm trying to see if you know the side effect of the TB drugs. Because it's very important, especially in this case, because you need to give them proper supplements when you're giving these medications. And if you don't know the side effects, you won't be able to give these supplements when you're prescribing them for TB. So that was an overview of management, and I hope that was helpful. Now let's move on to complications. Complications is kind of self-explanatory. They can either ask you directly as to what a complication is of a pathology, or they might give you a clinical vignette. For example, if a patient recently had an MI and now has recovered a few weeks in, they might start having pleuritic chest pain, and that's usually indicative of Dressler syndrome. Now lastly, let's go over prognosis. As you can see in the example that I've given, there are certain characteristics. For example, you might have certain signs or symptoms or certain findings on your imaging or your labs that might indicate a poor prognosis in the patient. Like in this case, there's certain EKG findings that are associated with poor prognosis. And in this case, it's actually all of them that are listed here. These prognostic indicators are extremely important, not just for the exam, but also for practicing. So just make sure you make a note of them every time you encounter these, either during your lectures or rotations. I would highly recommend that, because down the line when you start practicing, these red flags are going to be huge in diagnosing and getting the proper management for patients. I guarantee you these things can be both life and license saving. And now if you're wondering as to why I still haven't mentioned epidemiology all this time, well, that's because there are not many questions asked on epidemiology directly. I mean, not that it can't be asked, it's just not very common. However, epidemiology is quite important. The reason for that is just knowing epidemiology can help you eliminate at least 1 to 3 choices, or maybe even more. And that increases your chances of getting a question right tremendously. Because remember, the first line of every clinical vignette involves epidemiology. So if you know your epidemiology well, a lot of the times you'll be able to guess your answer just with the first 1 to 2 sentences, which can be huge. It saves you time and it increases your chance of getting an answer right. So don't ignore epidemiology. I would recommend that you pay attention to it and give some time to it because it will tremendously improve your grades. Alright guys, that marks the end of the video. I really hope you learned something new that you did not know before, and if you did, then show some love by smashing that like button, subscribing, and hit the bell button for future videos. Thank you guys. See you next time.